Here, yes.
Yes, hi, good afternoon. I have a child that was diagnosed with ADHD at the age of 5, and he's been on medication since then.
Ritalin?
No, Adderall XR.
Adderall, okay.
Yeah. So, do you have any recommendation?
Sure. And again, this is kind of the second time we've touched on this, and so I want everybody to listen up that has a child or a grandchild or a cousin or somebody with ADD, ADHD, regardless of age. This is a 4-year-old?
He was diagnosed at 5. He's an adult now.
Oh, he's an adult now?
Yes.
But as an adult, how old?
19.
19, okay. Young adult. So, does he have any history of skin problems, eczema, dermatitis, psoriasis?
Yeah.
Well, there's the bingo. Yeah, there's the bingo again. And so he can't absorb nutrients is a problem because his intestines are damaged. Remember seeing the rat intestines?
He doesn't have skin problems now, though.
It doesn't matter.
Okay.
Doesn't matter. He still has the clinical symptoms of the deficiency, which is caused by. Okay. So, do you have any other children?
Yes.
Do any of them have any asthma or skin problems?
Skin problems.
Skin problems. Okay. Yeah, they all have a gluten intolerance. Do you have any brothers and sisters?
Yes.
Do any of them have skin problems or asthma?
No.
Anybody have any bowel problems or appendix out, anything like that?
No.
Okay, well, if you have a gluten intolerance, if you're all blood brothers and sisters, then they got it too. You need to talk about their kids, see if any of their kids have any asthma or bronchitis.
I have a nephew with asthma.
Has a nephew with asthma? Yeah.
Yeah, I have a nephew
with asthma. It's through your whole family, so the whole family's got to be gluten-free. Then, 19 years old, is he a big fella or small or?
Thin and
thin.
athletic.
Okay, athletic, and so maybe what, 180, 175?
180, 185.
Okay, 180, 185. So, he needs 2 healthy brain and heart packs per month. Full dose of everything twice a day. I would also get him the Synaptive, so he can take 3 of those twice a day, be 2 bottles a month. That's for the brain function. Also, De-Stress, which has for the metabolism of the brain. I can take 3 of those twice a day. De-Stress, capital D like David, dash stress. And then none of the bad stuff. No fried foods, no processed meats, no oils, no gluten, no sugar in this case. And eventually he'll be able to eat a little bit of sugar, like a sweet potato or some grapes or something like that. But right now, he's going to be totally sugar-free. No juices, no fruit, dried fruit, fresh fruit. Vegetables will give him everything he needs from fruit without all the risk of sugar, because sugar contributes to these kind of things, makes them worse. But this is a easily fixable thing, but the underlying problem is a gluten problem. Can't absorb the nutrients, and this is why he's having problems. Okay?
Thank you.
Okay. Yes?
Good afternoon. I
Hi.
don't know where to start. The pain goes all the way through my body. I have narrowing here, degenerating spurs all the way down my spine.
Okay, bone spurs up and down your
Bones
spine.
hurt. And is that contributing to my legs?
Okay, yep.
The arthritis, where there's times I can't walk.
Okay. And when you lay down, is it worse or better? Or the
It's
same?
kind of the same.
Kind of the same,
I
okay.
sleep on like an angle.
So you find a place that's most comfortable.
Yeah, because they're
Okay.
trying to give me injections, and I don't want to do the injections.
Okay. Do you have any history of asthma, bronchitis?
No, just heart.
Okay. Anything going on with skin?
No.
Okay. Anything going on with bowels, like constipation, diarrhea, irritable bowel syndrome,
No.
appendicitis?
None.
Kids have any of that? Brothers
No.
and sisters have any of that?
No.
I'm still going to put you on a gluten-free diet anyway.
Okay.
Okay, no gluten, no wheat, barley, rye, and oats, no fried foods and processed meats, no oils, no gluten. And then you want to take 2 of the healthy bone and joint packs per month. 2 healthy bone and joint packs per month.
Mm-hmm.
A full dose of everything twice a day except for the glucogel, 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. And you can use the CM cream that come with those 2 healthy bone and joint packs. Apply that to your knees, okay? And if you get, the pain is 50% better but not totally gone, we have what we call a trauma oil. It's a blend of aromatherapy oils. You can apply 4 or 5 drops of that and a teaspoon of the CM cream and apply that to your knees or hips or your backs. Have somebody put on your back for you. Those spurs will go away without surgery. They'll just go right back into the bone. Bone spurs always occur whether in your heel, your vertebrae, your neck, your elbows. Bone spurs always occur where a tendon or ligament hooks into the bone, and as you move your muscles and bend over and twirl around, those tendons and ligaments pull on the bone, and the spur kind of comes up, or a calcium deposit comes up. You take the right nutrients, it'll support and promote maintenance repair, they go right back into the bone.
Okay.
Okay, do not get surgery for that stuff.
No, they were trying to do all that. I won't.
Yeah, no, don't get the surgery. Don't let them put rods or wires or plates or anything. Stay away from all that.
How about the injections?
Well, have they worked for you?
No.
Okay, have you ever heard that insanity is doing the same thing over and over and expecting a different result?
That'll
Albert
be it.
Einstein said that, and I'll take his word for it, right?
Okay.
Yeah, and so just remember, your doctor has to make a living.
Well, we go at it all the time.
Good. Well,
I'm very
if you go
combative
at
with
it all
that.
the
Yeah,
time, you know,
yeah.
I'd stay away from that doctor.
Yeah.
You can fire him online. The phone book is full of hungry doctors.
Yeah. So I ended up leaving without taking the shot. So the whole staff is like looking at me like, really? And I'm like, yes, really.
Yeah.
No.
Yeah,
No.
well, see, when they get somebody on a trail, and again, this is what Dr. King was going after, just like a mammogram. Okay, well, it's all highly suspicious here. We're going to err on the side of conservatism here. We're going to do a biopsy. Well, the biopsy is unequivocal. We can't quite tell for sure. We're still going to get you on chemotherapy and radiation and do a mastectomy because that's a prudent thing to do. Okay? And so they're going to run you through hundreds of thousands of dollars worth of treatment.
Yeah,
and you
but
really
I-
didn't need
yeah.
it because they need the income to get their kid through college.
Well, I asked the questions that people don't want to ask.
Okay.
So it's great.
Yeah.
Thank you.
So, yeah.
Thank you.
You're very welcome.
God bless you, Doctor.
Well, I know God loves me. I
yes.
love that part.
I'm standing instead for my sister. She's been on dialysis for 4 years.
And does she have diabetes also?
No.
Okay, so she got kidney failure.
Yes.
Okay. When you have kidney failure, there's nothing wrong with your kidney. I'm going to say that again because it strikes people as very interesting. When you have kidney failure, there's nothing wrong with your kidneys. I'll give you an example. Let's say you're taking a shower and the water's coming up around your ankles, around your knees, and it flows over into the floor in the bathroom. So you have your cell phone, you call a home appliance place, you say, look, I need you to come out here and replace my bathtub. Is that the right thing to do? No. What you want to do is call the plumber and say, hey, I need the willow tree roots rotor-rooted out of the drain because the tub won't drain. So when you have a kidney failure, there's nothing wrong with your kidney. Putting you on dialysis may be life-saving for a couple of weeks, but after that, you shouldn't need it. And so they'll put you on there for a couple of years until they really need some serious money. Then they'll find a kidney for you to get a kidney transplant. But I've had people that haven't urinated in 10 years. They're on dialysis 6 times a week. And after a couple of months, they're urinating again. After another couple of months, they're off of dialysis. It's easy to get people off of dialysis. What you have to do, remember, the kidney's okay. The reason why the kidney's not working is not because there's anything wrong with the kidneys, because the blood vessels that are carrying the dirty blood into the filtering unit are plugged. So our goal here is to get blood flowing into the filtering units. So what you do, you're sort of a medium-sized woman, right? What do you weigh?
She is.
Oh, she is. What does she weigh?
Yeah.
What does she weigh, you think? 150, 180?
150.
150, okay. So I'd give her 2 healthy brain and heart packs per month, okay, for just the general stuff, everything. Her kidneys and liver and heart and brain need all that stuff. But also, I'd get her the Ultimate Daily Classic tablets. Have her take 3 of those 3 times a day, 3 at breakfast, 3 at lunch, 3 at dinner. And then I'd have her take 2 a day of the Ultimate Cardio Sticks, 1 at breakfast, 1 at dinner time. I'd also have her take 2 a day of the Ultimate Niacin Plus. They are non-flush. They are time release. Have her take 1 at breakfast, 1 at dinner time. There's 1 bottle a month. And the whole idea here is to dilate those arteries going into the kidney, the ones that are already in the kidney, the arteries. The little afferent arteries are like 10,000 times smaller than the diameter of your hair. And they carry the red blood cells one at a time into the filtering units. Sometimes those arteries are so small, the red blood cell has to fold over like a taco to get through there, right? And this program will support and promote healthy blood flow through those blocked arteries into the kidney, and the kidney will wake up out of its hibernation, start working again. And sometimes, I'm sure they're taking a blood test every month and just putting it in the book like they're supposed to. Well, suddenly now they're going to see that there's improvement on the filtration rate, and they're going to say, we need to redo your test here. That doesn't seem right, and it'll be right. And so it might take a couple of weeks, it might take a couple of months, but it'll happen, okay? But it'll happen the quickest when she stays away from the fried foods, the processed meats, the oils, and gluten, because that's what plugs the arteries. Okay?
Thank you.
You're welcome. Okay.
Hello?
Hi.
I was asked really about kidneys, disease, and kidney failure.
Okay, so you have kidney failure.
Yes.
And do you have diabetes?
No.
Okay, I missed the first one then?
Kidney disease,
Okay, kidney disease. Okay, kidney failure. And you're a big fella. What do you weigh?
220,
220. Okay, so how long you been on dialysis?
3 years.
3 years, okay. I would do the same thing as this lady's friend. You need 2 healthy brain and heart packs per month. I'd go ahead and get the Ultimate Daily Classic. Go ahead and take 9 of those a day. That'll be 2 bottles a month. 3 at breakfast because you're a big fella. I'd have you take 3 at breakfast, 3 at lunch, 3 at dinner. I'd also have you take 2 of the Ultimate Cardio Sticks a day. Maybe 3. Take 1 at breakfast, 1 at lunch, 1 at dinner. So it'll be 3. It'll be 3 boxes a month. They come in boxes of 30. If it's a financial thing, don't go any lower than 2 a day. I would also do the Ultimate Niacin Plus. But I'd go ahead and get 2 bottles of those Ultimate Niacin Plus. So you can take 2 at breakfast and 2 at dinner time. And that's, again, going to dilate these arteries, get the blood flowing through. That's the whole idea of kidney failure. Now, you've got to stop the ongoing damage. Now, the interesting thing about when you have plugged arteries going into the kidneys and you require kidney dialysis to keep all the blood values correct, that's not the only place in your body you got blocked arteries. You're going to get them in your brain and get vascular dementia. You're going to get them in your eyes and get glaucoma. You're going to get them in your heart and get coronary artery disease, because the arteries in your body don't get obstructed in just one little place, because all the fried foods and processed meats and oils and gluten affect every artery in the body. So you're getting a warning that there's something bad happening in other places, right? And especially being a male, being a man, we tend to have worse results than women when it comes to these things. And so that's, you need to appreciate that. You need to be really serious about keeping away from the fried foods and processed meats, the oils and gluten. That includes dog food in the house has to be, dry dog food has got to be gluten-free. It's got to be rice and lamb. The first 4 ingredients cannot be wheat, barley, rye, and oats. Cat food, bird food, fish food, spouse, mother-in-law, kids, everybody in the household. If you have any brothers and sisters, if your mom's still alive, auntie's still alive on your mom's side, everybody's got to be warned. If you have sisters, blood sisters, their children will have the same problem. Okay, so it's important.
Thank you.
Okay, you're very welcome, sir.
Good afternoon.
Hi.
I'm a 48-year-old mother of 6,
Okay.
and I'm having trouble just keeping my body temperature to stay warm. I'm usually cold all the time. When everybody else is hot, I'm usually cold. I had blood work done. Only thing my doctor said I need was vitamin D.
Your doctor said,
I just need vitamin D, to take vitamin D.
I'm missing that body. Your doctor says you need...
I'm usually always cold all the time.
Yeah, I understand.
The doctor just told me I need to take vitamin D. They did blood work.
Vitamin
and all that.
D?
Yeah, just to take vitamin
okay.
D.
I got you, okay. How much do you weigh?
About 150.
Okay. And you have children?
I have 6.
You have 6, okay.
Yes.
Any of them have any health problems, asthma, bronchitis?
Yeah,
skin?
we all have asthma.
Oh. Okay, what's the problem, ladies and gentlemen? Gluten. You got it. You got a gluten intolerance.
Okay.
Your brothers and sisters, your mom if she's still alive, all your babies need to be gluten-free, man living in the house, spouse, or... Okay.
He the babysitter.
Babies, okay. But man, spouse, mother-in-law, kids, what do you work outside the home?
Yes.
And what kind of work do you do?
I work as an ambassador, and I do security.
Oh, your mom's an ambassador?
I said me. You said what kind of work do I do?
Oh, okay. Okay. Do you know karate and all that stuff?
No, sir, I do not.
Okay.
But if I had to take somebody down, I could. Yeah.
Okay. Okay. That's an equalizer, isn't it? Okay. 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 So, at any rate, yeah, at 150 pounds, I'd go ahead and have you take, again, 2 healthy brain and heart packs per month. Okay? And I want you to take the Ultimate Dailies Classic, Ultimate Daily Classic. Take 3 of those twice a day. And I also have you take, just try something as simple as the Ultimate Niacin Plus. Take 1 of those at breakfast and dinner. There'll be 1 bottle a month. Keep the cost down for you.
Okay.
And the idea is to dilate the blood vessels in your hands and your feet. Have you shrunk any in height since you were a child?
I may have.
Okay, possible. Okay, so yeah, you want to measure yourself now and go back and think, how tall was I when I was 18, and how tall am I now? Have I shrunk an inch or a half inch or something? Because that can impact. Because you can actually smash some of these nerves, which will in your back, which will clamp down on the blood vessels going into your feet and hands, and have cold hands and feet because of a back problem. That's also a possibility. And so, but it's going to be imperative to get the whole household gluten-free, okay? And be aware of that when you're around people, when you're doing your security job and stuff. Be real careful about shaking hands with people you just saw. Oops. Oh, she needs to be a pitcher. That was pretty good. Okay.